Basal ganglia includes different nuclei which are caudate nucleus, putamen, globus pallidus, subthalamic nucleus, also body of Lewis, and substantia nigra. Caudate nucleus, it possesses a head and a tail which is terminating at the amygdaloid nucleus. The caudate nucleus and putamen together they are called as corpus striatum or neostriatum, that is the newer part of the basal ganglia. Putamen and globus pallidus. Putamen and globus pallidus are together called as lenticular nucleus, whereas globus pallidus is also called as paleostriatum, and globus pallidus is subdivided into external and internal segment by medial medullary lamina. Substantia nigra is subdivided into two parts, that is pars compacta and pars reticularis. It is particularly rich in copper content. The basal ganglia, the three biochemically distinct pathways normally, or three or four, operate in a balanced portion, that is nigrostriatal dopaminergic system, intrastriatal cholinergic system, GABAergic system that projects from the striatum to globus pallidus and substantia nigra, then glutaminergic system. The unique feature of basal ganglia is high oxygen consumption and it has a high copper content. See the connections, afferent connections to the basal ganglia. The main afferent connections to basal ganglia terminate in the neostriatum and are excitatory, that is, it contains cholinergic neurons. They include corticostriate projection and thalamostriate fibers. Corticostriate projections, they form afferents from all four lobes of the cerebral cortex, but mainly from the frontal, that is motor areas, and parietal lobes to the neostriatum. Whereas thalamostriate fibers, they are projection of fibers from interlaminar, medial and ventral, anterior and centromedian nuclei of the thalamus to the neostriatum. Coming to the intranuclear connections, there are dopaminergic nigrostriatal fibers, GABAergic and glutaminergic fibers. Dopaminergic nigrostriatal tract pars compacta of substantia nigra contains cell body having dopamine, that is inhibitory, it is an inhibitory neurotransmitter, and its axons terminate in neostriatum. The degeneration of this neuron causes parkinsonism, or it is also called as paralysis agitans or shaking palsy. The GABAergic inhibitory projections from the neostriatum, they are project to the pars reticularis of substantia nigra to both internal and external segments of the globus pallidus. The external segment of the globus pallidus projects to the subthalamic nucleus, and subthalamic nucleus projects via glutamic acid secreting excitatory neurotransmitter to both internal and external segments of globus pallidus. So this is the circuit of the basal ganglia, where the basal ganglia, the main input nuclei is striatum. It receives afferent from the cerebral cortex. Then you have a direct or indirect pathways. From striatum, the information goes to the globus pallidus internus, then to thalamus, back to the cerebral cortex, which forms a loop, which is direct loop. And in another path where cerebral cortex fibers, they go to the striatum, they go to the globus pallidus externus, and then they go to the subthalamic nucleus, back to the globus pallidus internus to the thalamus, which will form the indirect pathway. Okay, so here we mainly have the glutaminergic pathways, acetylcholinergic pathways, GABAergic pathways, and dopaminergic pathways, which connect striatum to the substantia nigra. So here this is showing the loop. The impulses come from the cerebral cortex to the basal ganglia, where it is processed, and the information sent back to the thalamus, back to the cerebral cortex, which is forming a a direct or indirect loop. Efferent connections. The main output from the basal ganglia from the globus pallidus and substantia nigra from the internal segment of the globus pallidus via thalamic fasciculus to the ventral, ventral anterior and centromedian nuclei of the thalamus. From the thalamic nuclei, fibers project to prefrontal and premotor cortex. Ventrolateral pars reticulata of the substantia nigra projects to ventrolateral and ventroanterior nuclei of the thalamus. There are a few additional projections from this part of the this part to the habenula and superior colliculus also goes. So this is the output to the thalamus. It mainly comes from the globus pallidus internus, whether it is a direct pathway or indirect way, and also the output comes from substantia nigra to the thalamus, which is usually inhibitory in nature. The main feature of connections of basal ganglia that cerebral cortex projects to the striatum to internal segment of globus pallidus, internal segment of globus pallidus to thalamus, and thalamus back to the vertex, thus forming a loop of direct pathway. The other pathway is from the cerebral cortex. It goes to the striatum. It goes to the globus pallidus externus, then subthalamic nucleus, then globus pallidus, then back to the thalamus, which is going to form the indirect pathway. The output from the internal segment of globus pallidus, that is thalamus, is inhibitory, where the output from the thalamus to the cerebral cortex is excitatory. Okay, so here what happens in the basal ganglia is there are two pathways, that is direct pathway and indirect pathway. Direct pathway, it comes from cerebral cortex to the striatum to the globus pallidus, then back to the thalamus. Okay, so which is usually excitatory in nature, because cerebral to striatum is glutaminergic, striatum to globus pallidus is inhibitory, and globus pallidus internus to the thalamus is inhibitory. So inhibition is called as disinhibition, and it is going to excite the thalamus. So direct pathway has excitatory inputs to the thalamus. Then indirect pathway, where the impulses come to the afferent comes to the striatum, then it goes to the globus pallidus externus, then to the subthalamic nucleus, then to the globus pallidus internus, back to the thalamus. Okay. So which is called as indirect pathway, and usually it is going to stimulate the striatum. Striatum is going to inhibit globus pallidus externus, which in turn going to inhibit subthalamic nucleus. That means it is excited. So subthalamic nucleus is going to stimulate globus pallidus, and globus pallidus is going to inhibit thalamus. So it is the effect of indirect pathway on the thalamus is always inhibitory, and the activity of the basal ganglia, it depends on the balance between the direct pathway and indirect pathway. That is usually the inhibitory pathway, they are going to dominate the excitatory pathway. Functions of basal ganglia. It has a role in planning and programming of motor activity. It is process by which an idea of involuntary movement is converted into precise action. The mechanism is the activity in the circuit between subthalamic nuclei and globus pallidus is an important regulator of basal ganglia output that in turn maintains movements in a smooth and appropriate state. Then they help in the control of muscle tone. Basal ganglia inhibits stretch reflex, that is muscle tone, by stimulation of caudate nucleus and by stimulation of inhibitory motor cortex as well as inhibitory reticular formation. This is why damage to basal ganglia causes rigidity. Then it has a cognitive function. Caudate nucleus play a role in the cognitive processes like thinking process in the brain, using both sensory inputs to the brain plus information already stored in the memory. The lesion of the head of the left caudate nucleus associated with dysarthric aphasia, that is difficulty in articulation of the words. Then it has a role in subconscious execution of some movements. Basal ganglia is responsible to control. Uh, it is responsible for the control of normal automatic and associated movements such as swinging of arms during walking. These movements are initiated by motor cortex. Then other function is neostratum regulates subconscious gross movements occurring in the group of muscle, and the other function is the activity of the basal ganglia increases during slow steady damp movement and is silent during rapid and saccaric movements. Globus pallidus provide muscle tone for the performance of skilled movements, and substantia nigra is a center for coordination of impulses essential for skilled movements. Then diseases related to the basal ganglia, that is Parkinson's disease. It is also called as paralysis agitans or shaking palsy. It is caused due to the degeneration of substantia nigra or globus pallidus or both, and usually occurs in late middle age. Therefore, the concentration of dopamine in this region, that is nigrostriatal system, is reduced. Hence, the balance between excitatory discharge of cholinergic interneurons and inhibitory dopaminergic input in the neostratum is disrupted. The Parkinsonism occurs in, or rather, it is primarily idiopathic, and that condition occurs without any apparent cause. Some of the etiological causes are it can be secondary to cerebral arteriosclerosis or complication of encephalitis or complications of drugs such as phenothiazine, which blocks the dopamine receptors. And symptoms appear when 60 to 70% of the nigrostriatal dopaminergic neurons are lost. Characteristic features of Parkinsonism: it has both hyperkinetic and hypokinetic features. The important features are rigidity because of the hyperkinetic activity due to the increased discharge of gamma efferents supplying the muscle spindle. It affects mainly the large proximal group of muscles of limbs involving both antagonist and protagonist, that is biceps, knee flexors and sternomastoids. Here the posture is that in flexion attitude, the back is flexed and arms are adducted and flexed and knees are bent, that gives a stooped posture. And rigidity may be a cogwheel type. Here resistance is intermittently released and it can be lead pipe type. Here the resistance is throughout the movement. The mechanism for rigidity is the activity of neostratum is influenced by excitatory effect on cholinergic fibers and inhibitory influence of the dopaminergic fibers. Normally there exists a balance effect of these two opposite innervation on the neostratum activity. Lack of dopaminergic activity due to the degeneration of substantia nigra shifts the balance towards the excitatory cholinergic fibers. There can also be tremor, which is hyperkinetic symptom. It consists of regular rhythmic alternate contraction of antagonist and agonist muscle at the rate of 6 to 8 times per second. It is commonly seen as a pill rolling movement, that is rhythmic contraction of thumb over the first two fingers. As it is present during rest and disappears during activity is called as resting or static tremor. It increases in emotional states, excitement or anxiety due to the secretion of epinephrine, which in turn excites reticular activating system. The tremor disappears during sleep due to the decreased activity of reticular activating system. The causes here for tremor is due to the degenerative lesions in reticular formation and in ascending connections. There can be weakness and poverty of the movements, which is a hypokinetic movement. Difficulty in initiating voluntary movements, which is called as akinesia. This produces defect in fine movements of fingers. The defects in fine variations of speech can also be there. There will be mask-like facial expression due to the decrease in movements of facial muscles. There can be loss of normal subconscious associated movements, for example, swinging of the arms during exercise, and there can be tendon reflex elicitation becomes more difficult because of the rigidity. Then gait is called as fascinant type of gait or shuffling type of gait. The patient is bent forward and walks quickly with short steps as if trying to catch up the center of gravity or preventing himself from falling down. There can be retropulsion. uh, if the patient is suddenly pulled backwards, he begins to walk backwards and is unable to stop himself. Then the tender jerks becomes progressively difficult to elicit as the rigidity increases. So these are some of the characteristic symptoms of Parkinsonism. There can be head nodding, that is tremor in the hands, or pill rolling movements in the hands, stoop posture because of the increase in the rigidity, arms are flexed and at the elbows and wrist, hips and knees are slightly flexed. Okay, so you can see the tremor and you see short shuffling gait, which is also called as fascinating gait. Treatment: administration of drugs L-DOPA. It can cross the blood-brain barrier and reach the brain tissue where it is converted to dopamine. Then other modality can be transplantation of dopamine secreting cells which are obtained from the brains of aborted fetus into caudate nucleus, and putamen has been used with some short-term success to treat Parkinson's disease. Surgical treatment by making lesions in the internal segment of the globus pallidus, that is pallidotomy, or in the subthalamic nucleus helps to restore the output balance towards the